Hello and welcome. Today we are pleased to welcome Dr. Olaf Groth, Managing Partner of Cambrian.ai, a think tank consultancy for clarity and strategy in the human-machine economy. He's also a visiting scholar at UC Berkeley, the Roundtable on the International Economy. He's part of the expert network within the World Economic Forum, addressing the fourth industrial revolution. And he's a professor for strategy, innovation, economics, and futures at the Hult International Business School. Dr. Groth, welcome.
Thank you, Neil. It's good to be back.
Great. So let's go right to it. Looking towards the future of AI and where AI is moving, particularly in one facet when it comes to examining the practices of developers within AI, can you speak a bit about clinical tests for AI code?
I'd be happy to. Look, this is a creative challenge that I'm really just teeing up here, to use a golf term, for the creative talent in business schools and in policy schools and elsewhere. And that is that we have seen large internet corporations deploy lines of code and neural networks that when fed with data on websites and communities like Facebook can lead to mass impact in swaying hundreds, thousands, millions of users in certain directions. Sometimes that code will drive a whole country into different voting behavior. We have seen this in the United States as well. And so it beckons then us to consider, how do we deal with that kind of code? Do we just let it run its course and be surprised at the second and third order effects? Or do we need to take a more formative approach to this challenge? And one of the things that one can do is to look at analogs or proxies to mass deployed software code. Software code that's mass deployed gets into people's heads, it gets into people's minds. That's why they're driven into different political camps or into different commercial convictions or into different fear or excitement patterns about certain products and services. So as such, the analog might be certain mind-altering drugs. We regulate those drugs through FDA processes here in this country and other health and nutrition agencies in other countries. And could we imagine, therefore, something like rapid, quick, and agile clinical testing for algorithms and neural networks that are going to be mass deployed and that influence tens, hundreds, millions of people? Is that a viable path? So we are currently exploring this topic, its pros and cons. We definitely feel that we need to system test code that is so deployed, because the people who own the code, the people that design the code, the people that run and make money with the code need to understand how human groups, communities, societies, whole economies change, how their fabric changes when that code is mass deployed. Whether or not the FDA approach or the clinical drug trials approach is the right one is to be determined, because you can easily see the drawbacks. We do not mean to suggest that corporations, large and small, certainly not agile startups that need to move fast to get to market, that they go through month-long, if not year-long approval processes for simple lines of code. We need to make sure that these ventures still remain agile and entrepreneurial and can pivot really fast. So we need to modify this approach. And that's where the creative minds of today's entrepreneurs and of software talent are in demand. Can the community come up with some kind of self-discipline, some kind of self-reflection to say, well, what kinds of solutions can we come up with that will allow that kind of system testing very quickly? Some experts have told us that because software can be shuttled back and forth really quickly, data sets can be shared very quickly, that we could actually come to a computer science version of drug testing that is much quicker and much more agile, reasonably fast. We don't know, we haven't tried yet, but we think that we should try. And Cambrian.ai certainly wants to be part of that solution set. So we are working on brainstorming with software experts to put those solutions in place. So stay tuned. We don't know what shape it's going to take. The last thing we want to do is stifle innovation, but we also believe that certain constraints on ethical and responsible and human-centric behavior can actually increase innovation and increase the economic, not just the human benefits of those technologies. Because the one thing I can tell you, Niels, that I'm really afraid of is when people ask me on the news and elsewhere, what are you afraid of most with AI? Frankly, it's not the typical answer of, robots shooting everybody or Terminator style scenarios or, a la Messieurs Musk and Hawking, that all the machines will take over. It is that we will miss the phenomenal potential of artificial intelligence for human and societal growth. And the way to miss it is to screw up really badly in a massive amount of people in our populations so that they get harmed, scared, and will turn away from artificial intelligence altogether. And that will be a tragedy par excellence, because we believe that there is so much we can do for people and for societies. Just think about using artificial intelligence in climate change, in politics, in health, in education, all kinds of areas, quite outside of efficiency increasing production and manufacturing and service industries. So much good that we can do, help us live healthier, longer, better educated, richer lives, right? And the last thing we want to do is preempt that, because there is a massive backlash, because we were sloppy about it as innovators, as entrepreneurs, as business professors, right? And so we want to be on the leading edge of that.
Dr. Olaf Groth, once again, thank you very much for sharing your thoughts on possible clinical trials for AI code. It has been a pleasure.
Anything for our young entrepreneurs, Niels. Thank you for having me.
And likewise.